Hi everyone, Kate here from CCDR. Today we're going to go through the Australian Patient Organisation Network Annual Report covering the period of 2020 to 2021. Just as some background, Apon was announced in 2019 and launched with an inaugural conference. Before the conference, we sent a questionnaire out to patient organisations, and that fed into the design of the conference sessions. During the conference, there were a lot of different breakout groups, and we collected that information throughout the conference to develop this program of work for the Australian Patient Organisation Network. Our role at CCDR is we've taken on the commitment to implement the program of work. So this is an update of where we're at with that program of work. So to date, we have 135 organisational members in the Australian Patient Organisation Network. It's free for health charities to register as a member, there's no cost, and it's the largest network of patient organisations in Australia. As I said, CCDR hosts the network and we provide the back-end support. It's overseen by a standing committee from a range of organisations, and that's chaired by Monica Ferry from the Genetic Support Network Victoria. The program of work has 6 pillars. So I'm going to go through very briefly the update on each of our goals and activities. And of course, there's the online report that you can read if you'd like a little bit more information. So the first pillar is in relation to strengthening community actions. So the first activity that we have is to convene an Apon conference annually. So we did this in 2019. We weren't able to last year, but we were able to convene some special COVID sessions and then produce a report on the impact of COVID on patient organisations. We were then able to run an awareness campaign around the struggles of patient organisations during COVID and also advocate to government for support. The second activity is to develop and implement a system to identify common advocacy platforms. And this is all meant to lead into the annual conference. So throughout the reporting period, we ran 14 online workshops or brainstorming sessions, and each interest group were identifying common themes throughout those brainstorming sessions. One of those common themes is to raise awareness of the role of patient organisations and what they can contribute to the health system. And this is what we're carrying forward to the 2021 annual conference. The next activity is to develop a registry of Australian patient organisations. So we've done that, and that's online. Anyone can access it. It's being added to all the time, and currently we have 451 organisations listed in the registry. The fourth activity is to develop a registry of opportunities for engagement in decisions and funding and collaboration, and an alert system for patient organisations for this. So we've developed an internal system where we scan the internet and the funding bodies to see what's available for patient organisations to apply to, what they might be able to engage in terms of decision making. And then we feed that through a monthly newsletter, and also we list it on our webpage. We also have an alert system in place for the PBAC meetings. So we export the PBAC agenda and then put it into a searchable database, just so it's a bit easier for patient organisations to see what might be considered at each meeting that's relevant to their disease area. So this is the media that was raised around the impact of COVID on patient organisations that came out in July 2020. Still in Pillar 1, strengthening community actions, the next activity is to provide a system for P2P Mentoring for Apon members. So this is something that we trialled. We put a call out for Apon members to participate in a support group, and also the opportunity for one-on-one mentoring. There wasn't very much uptake on this particular opportunity, so we're going to take that back to the standing committee and see if there's any adjustments we can make or different activities that we could do that address this need that has been identified by Apon members. Pillar 2 is around developing personal skills. The first activity is to develop a repository of tools, resources, and that marketplace for patient organisations to share and connect. So we've developed a suite of tools to help patient organisations understand the Australian health system. And alongside each of the information sheets is a PowerPoint presentation and facilitator notes so that patient organisations can run internal or external information sessions on the topic. We've also trialled an online marketplace where organisations can share and request tools. So this was launched at the start of the pandemic and it didn't have much traction. So we're going to look alongside the standing committee and discuss whether we can try this again or maybe adjust it in a different way. The next activity is to provide education and support via webinars between the annual conferences. So collectively, including some of the workshop and brainstorming sessions, we've held 20 webinars and brainstorming sessions across the reporting period. And we've also established the Apon newsletter, including interviews with Apon members and also local health professionals. Still in Pillar 2, is the Patient Pathways Pilot. So this is a telehealth nurse case management pilot project across 11 disease areas. So the long-term goal is that there'll be a pool of funding for patient organisations to access telehealth nurses within their organisations. This is something where CCDR also provide that back-end support. So we have central project management and central evaluation of the project. So that first evaluation of the pilot project will be available in August, but some of the highlights that have come out is that we've been able to develop a funding model for patient organisations. We've defined the roles and remits of a telehealth nurse that sits within a patient organisation, and we have that minimum data set for evaluating the value that telehealth nurses bring within a patient organisation within a community-based setting. So we're talking with government about future funding for this kind of program, and we'll be looking at an advocacy campaign with Apon members once we release that report next month. The next activity was to develop a framework for community engagement. So this is something that's yet to commence. We were waiting for the World Health Organization. We're developing a community engagement framework. It's yet to be released and there's no indication of when it will. So we're going to just have a bit of a look around if there's existing frameworks that we can maybe adapt to the Australian setting. Where we'll have a bit of a different focus for the Australian version is looking at an ethical framework for patient feedback and decision making. So making sure that when patients give feedback, that there's good processes that for the people collecting that data to then feedback to the patients how that information was used in decision making. Pillar 3 is around creating supportive environments. So the first activity is to create a mechanism to ensure that equitable access is addressed through the Apon activities. So the first thing that we've done is we've developed a vulnerable populations interest group. So there was an opportunity to join this group, but there wasn't very much interest, so we weren't able to go ahead with that. This is another one of those areas that we're going to take back to the standing committee to discuss how we might be able to address this need that's been identified through the Apon community. The second activity is to develop research questions to implement across a range of disease area to understand the impact of stigma in vulnerable populations. So the activity that we're doing here is that we've developed a protocol to understand how citizens access health service across universal health coverage domains. So this will be an online questionnaire and interview, and then as part of that analysis, we'll be looking at whether stigma has an impact on how people access or have the ability to uptake health services. And we'll be starting that project this month. In Pillar 4, we have the theme of Reorient Health Services. The first activity is developing working groups within Apon. And through the conference and the pre-conference work, there are a number of areas that were important. Those included access to medicines and health technology, clinical trials, health system navigation, digital health, and vulnerable populations. So there's been a number of those groups that we've actually been able to consolidate because they had a lot of crossover discussions happening. So the groups that we have now are the access to medicines and health technology, and then we have the health services, health system and navigation are combined with digital health, and then clinical trials, research and clinical registries are all together as well. So from those working groups, we have 3 projects that have come through. 2 are currently being implemented, and 1 we're looking for funding to be able to implement. So the first one is in relation to access to medicines and health technology. So this is where we're testing questions to understand the impact that a condition or disease has on a patient's life, so that that can be better explained to those making decisions in the context of access to medicine. Clinical trials, registries and research group have a project where we're identifying the roles that patient organisations can play to support clinical trials and research. So that's looking at from the position of a patient organisation within the community, how can their expertise and their connection with the community be leveraged to support clinical trials and research, but also what kind of research can patient organisations conduct themselves to better understand their communities. The Health Services Systems and Navigation Group, the project that's come out of that is an audit of patient organisations in Australia to understand what our collective contribution to the health system is, and to make it easier for patients to navigate the services that we provide as a community. The second activity is to develop a central system where patients can register to be involved in research, policy, program development, and so on, and then be connected to researchers and policymakers that are seeking patient input. So we're currently testing this in oncology. So we have the infrastructure set up, and we're testing a system where patients can put their hand up to be engaged in that feedback process. Researchers can also request the input of patients, and we're trialling different systems that can be done online, that can be done by a facilitator external to a research group or policymaker. And then a third approach where it's bringing everybody together, the researchers, policymakers, the patients and the patient organisation as well. Pillar 5 is about building healthy public policy. The first activity is to develop health program and research impact measures that reflect the values important to patient organisations. So this is aligned too with the project that's come out of the Medicines and Health Technology group. So as we test the questions where we're asking patients what's important to them and how their condition has had an impact on their life, we'll then be looking at those to see from a values perspective what's important to patients. And then this can be taken back to the standing committee, and we'll discuss some next steps. The next activity is about prospective research methodologies, pilots to test the best practice in community engagement in various contexts. So this is really everything that we're doing in Apon. We're testing different ways, we're piloting, and we're evaluating, including this annual report. The next activity is to develop and validate levels of evidence for patient experience, patient feedback, and real-world data. So this is something that was already in progress before Apon existed through CCDR. We've put this and the next activity in the program of work just so that it's so that everyone knows that we've acknowledged that it's been something that the Apon community has raised as an issue, and that it's something that we're trying to address. So this is something that's a work in progress. A group of patient organisations participated in a workshop to scope out the different kinds of evidence generated and identify the kinds of evidence that are used in patient feedback. So the next step is that we'll be looking for some funding to take this forward, test and validate those different levels of evidence. So what this means is that, when we're looking at things like clinical evidence, we see levels of data that we're comfortable to accept when we're assessing evidence. So we want to have that same kind of system for patient feedback and real world evidence. So that's what we're looking into. The next activity is to develop a repository of patient experience and expectations data that can be used in decision-making processes across the health system. So this is part of CCDR's core work, is the Personal Experience Expectations and Knowledge program. So we systematically collect information from patients in both interview and online form, and it feeds into a repository of information that anybody can access. All of the reports are online. So at the moment, we have the largest repository of systematic patient interview data in the world, and it's something that's growing all the time. If your patient organisation is interested in collecting information from your patients in this systematic way, please feel free to get in touch. Pillar 6 is moving into the future. So the first activity is to develop a national campaign to increase awareness of the role and services provided by patient organisations, and also increase health professional referrals to patient organisations. So this has come up again as we've gone through the interest groups. So a very strong call for patient organisations for this to happen. So this is going to be the focus of our 2021 conference. At the moment, what we've done is put out an expression of interest to public relations and government relations agencies to provide some pro bono support so that they can guide us in developing what's our message, what would this campaign look like. So again, this is going to be the focus of the 2021 conference. So we hope to see you all there. The next activity is developing a system to classify patient organisations according to the service they provide. So what we're going to do in this particular activity is build on the audit of patient organisations that we're aiming to do. And then once we have that audit of patient organisations, we can look at the common areas of activity that patient organisations provide, classify those into different types of organisations. So it's not a classification that ranks patient organisations, a classification that describes patient organisations, so that if, for example, a patient is looking for support, they can easily see what organisations do. Are they a research organisation? Are they an organisation that might provide support and information? Do they also provide advocacy? So just making it a little easier for patients to navigate our part of the health system. So that brings us to the end of the presentation of the Apon Annual Report. The next annual conference will be held in Melbourne, 15th to 16th November. And of course, the conference is free to all Apon members. If your organisation isn't an Apon member yet, that's no problem. You can register anytime. If you have any questions or aren't sure how to register for Apon, you can contact us at administration@ccdr.org, and we'll be opening up registration for the conference in August.